Oh gosh. All right.
Hi.
Hi.
Long time no see, everybody.
It's been a hot minute.
It's been a while. Getting back into it.
Welcome to our next episode of MMAC Minute.
Yes.
This is our 6th episode. I did look
Good job.
before coming in here.
Last time we did not, so.
I know, I did.
She's like, no, I think it's 5. I'm like, I don't think
It's
so.
crazy. So we're going to start right off with please like this episode. Please share to all your friends. And please subscribe.
Mm-hmm.
And hit the notification button so that you get notified of our new episodes.
So you don't miss episode
Don't miss a
7.
thing. That's right.
And leave us a comment. Let us know, how were your holidays? What was your favorite part? Tell me your least favorite part if you want. That's fine too.
So I got to tell you, I'm going to be really consumed with my hair today because I just got it cut on Monday, and she did like the full like wet cut.
Oh yeah.
Which to me, it just kind of shocks my hair. And
Oh really?
I feel like it looks just like
No.
dead limb. So I'm probably going to be looking at it and fussing with it the whole time.
Like when you're FaceTiming somebody and they're just looking at themselves and you're like, hey, focus.
Yeah, that'll be me.
Sure.
Yeah. That'll be me. I'm so bad at this.
We got new mics to go with my new phone, so we are
they work.
starting over. Okay. All right. So today we are going to be talking about hot topic.
Tear troughs.
Eyes. Under your eyes, these troughs for your tears.
Yeah. They're supposed to be there.
Yeah. Yep.
It's a frequently asked topic.
Yes, it does come up a lot.
I definitely have opinions about it.
Yep.
I don't know about you.
I do. We do.
It is one of my least favorite places to fill because it is one of the predictably most unpredictable places.
Yeah, that's a good way to put it.
And I'm just going to start right off and tell you that it's never just about the tear troughs.
True.
It's never just about the lips.
Right.
It's never just about the tear troughs.
Right. Oh, I should have brought that little diagram, the fat pads.
Oh.
I'm going to grab it.
Okay. And I'll just kind of go on.
Entertain them.
Yes. So when we talk about tear troughs, we are talking about depth from the inner canthus of the eye kind of down at a 45-degree angle from that towards the mid cheek. And even some people have a deficit just completely underneath. But tear troughs can really vary. You can have a hollowing of the tear trough, or you can have sometimes a herniation of the fat pads and skin beneath the eye. Yeah, magic.
Ooh.
Magic. And so there's a lot of variables and a lot of variations in tear troughs, and what bothers one person may not bother another. And we have a lot of structural differences and also some just anatomical things and also some very pertinent aging factors, right?
Yep. I feel like this one isn't as easy to see as the other one, so I'll superimpose it in there, but yeah, that's not very good. Okay. I'll stick a new one up there. Let's just throw that one on the floor. We don't need that one.
We hate it.
Get away from me. Anyway, all that to show that we have, lots of different fat pads in the face. And it's these little buggers right here. Those ones always want to change on us first. And that causes a lot of issues for all of the surrounding fat pads and the tissues around there. So, that can make a lot of people will say like, oh, my under eyes are making me look so tired. And whenever somebody says that, the first place I want to point out to them is the cheeks. Is this area starting to get a little hollow? Because once that happens, everything above and below will start changing. We'll get a little more redundancy here, a little fold over the nasolabial area. We'll get a little hollowing under here. And it's not that under eye fat pad got bigger. It really shrank, right? But we're missing the connection, that tight connection with the fat pad here. So that's something.
Well, and we have superficial fat pads and we have deep fat pads, and both of them get affected.
Yeah.
This is a really interesting thing that I recently learned, is that all of the fat pads in our face, superficial and deep, they shrink in size, become smaller, except one. And the fat pad that runs right along here on your nasolabial fold is the only one that becomes longer and wider. So again, contributes to what you're seeing here in the mid face. And then it affects what's happening here,
Yeah.
right? And so you can't take it out.
Yeah.
Don't want to take
No,
it
we don't
out.
wanna
We
take it
need
out.
to. You
Yeah.
can't really flatten it out.
Right.
So that this is connected to this, which is
Mhm.
connected to this. So
Mhm.
they all work together. So when we say it's never just about the tear troughs, it's never just about the tear troughs.
Yep.
And when you come in and you like, what are you hoping to improve today or talk about?
Mhm.
We want you to point to your area of concern, but
Sure.
that doesn't necessarily mean we're going
That's
to.
the first area we're going to treat.
Exactly.
Yeah, because
Yeah.
could
And
be other
Mallory and
things
I
going on.
think both have the same philosophy that when she talked about already the mid face need to be revolumized, restructured, it's almost a hard stop for me. Like, this almost always needs to be addressed before I'm going to talk to you about your filler.
Yep,
in
totally.
your tear trough.
Totally. That needs to
So
heal, integrate into the tissues. That needs its time. I agree.
Mhm.
Yeah, absolutely.
Mhm.
Yep.
Yeah, it's almost, you have to go to somebody you trust. You have to listen to what they say and
Yeah.
their reasons, and really do trust them.
It is worth the wait.
because It is worth the wait.
There are so many clients
yeah.
that have said, like, we can't do the tear troughs today too. And I'm like, let's just do this first. I'm happy to see you again in a
Mhm.
couple weeks. Let's check in.
Mhm.
Let's see how things are going. And then it's like, oh, you know what? I didn't need tear trough filler after all.
That's the good news.
Yep. Yeah.
That's the good news. Often if you just structure it,
Mm-hmm.
provide counter structure there, the deficit you're seeing is lessened enough that you don't feel like
Yeah.
you need
Yeah.
as much change in the tear trough.
Right.
I think there's a couple of things to know about tear troughs that maybe are considered kind of bad news. There's good news, bad news, right?
Yeah.
The first is, and we rarely want to say something is never or always, right? To say never or always is always wrong and never
Never
right.
say never.
Right? Never say never. It's always wrong, never right. Except when it comes to tear trough filler, I will tell you that it will always need to be dissolved at some point.
Yeah.
Always. It could
Plan for that.
Yes. And it doesn't mean that you did anything wrong in taking
No.
care of it.
It doesn't mean that injector did anything wrong. Right.
You're injecting a gel filler into a void.
Yeah. Yeah.
And with the gel filler, there's hyaluronic acid strands. It's like 2% hyaluronic acid strand, 98% sugar gel.
Mm-hmm.
And those hyaluronic acid strands work to bind that sugar gel together and keep it cohesive. The hyaluronic acid strands break down and disappear, just like our own hyaluronic acid does as we age.
Right.
And so when that happens, the sugar gel, some of it deteriorates, but a lot of it stays there, and there's nothing to keep it in place. So it floats around, and it has to be dissolved at some point. It just does. And again, it's just a known. I can't tell you it'll be 6 months. I can't tell you it'll be a year. It could be 7 years. It's going to be different for everybody, but just don't be surprised when it happens.
Mm-hmm. Mm-hmm.
And your injector, like I said, if you find one you trust, you let them know that you've had tear trough filler, then they'll know what to look for.
Yeah.
It's pretty, we kind of know what it looks like.
Yeah.
And so we can dissolve it and then see if things have changed and maybe you'd benefit from structure and volume someplace else to help that, and go from there.
Mm-hmm.
Clean off your blackboard.
Yeah. Start over. Start fresh. Yeah. So another thing, maybe bad news, maybe just like be aware of reality check. Would you, if we decide that you're a good candidate for tear trough, would you be happy with like a 20 to 30% improvement?
Yeah.
It's not like, I think we have this idea in our head of like, what would my perfect tear trough look like? Like, no, it would be perfectly smooth. There's no indentation, no hollowing, no nothing. And that's probably not realistic. Again, it's a tear trough. Where are your tears going to go?
Mallory has as close to perfect tear troughs as probably I've ever. I do not. Yeah, I do not. I have I think it's this side that's much more affected than the other side.
I can see it.
Oh,
a little bit. Yeah.
Mm-hmm.
Okay.
And that's kind of something to talk about too. I keep putting this like up in front of my face. What's it saying?
Are you feeling self-conscious?
Oh, yeah.
See your hair?
Yes.
She warned us. She did.
What was I saying?
I forgot now too. You distracted me. Tear troughs, perfect. 20 to 30% improvement. Are you going to be happy with that? Because we are not shooting for 100% improvement. We're not shooting for 60 or 70. We're shooting for a little improvement.
30%.
Yeah, 30% is
we
great.
want to improve or reduce the amount of shadowing that you have, so that things look less, that you see less of a need for filler.
Yes.
Our whole philosophy with filler is we never want you to see the filler.
Right.
We want you to see less of a need for filler.
Yep.
Lips are a little bit of a different thing.
Sure.
Because they do look a little different. But lips is a whole nother discussion.
But that's a good point to bring up about filler in most places, is like, you know, when you're doing cheeks, when you're doing temples, anything like that, really we're not doing like lifting. Filler doesn't lift. We're playing with highlights and shadows. We're kind of like contouring, so that if somebody was really good with makeup, but if somebody was really good with makeup, like a makeup artist, you know, you can change how your features look. They can almost like lift things, where you could spend a good 2 hours in front of the mirror with some, you know, different shades of makeup and create a lifting effect. That's sort of what we can do sometimes with good filler. Yeah. Where you don't see the filler, you just see like, oh, you look well rested.
The effect of it. Yep. There's several different products that, you know, like there's some Vicross technology that's available that has been FDA cleared for treatment of, what do they say? Treatment of infraorbital hollows. Yes. Yeah, that's how they're saying it. They're not saying tear troughs, but infraorbital hollows. Not my favorite product. I think it tends to have more complications or issues and harder to dissolve. Yeah. Kind of the tried and true, the one that's been around for 26 years, Restylane Classic. I mean, it really is it's the powerhouse go-to for tear troughs, in my opinion. Everybody will have a different opinion. Other injectors will have different experiences with different products. Sure. And again, you go to injector you trust, and you know, go with their
discuss that, make that decision together. But ultimately,
and then Restylane Classic, they have a new one that is specifically designed for the correct amount that they suggest to be put into tear troughs at any one time. Yes, and they have called that eyelight. So it's packaged to be used for lips,
for tear troughs, for infraorbital hollows. Yes.
You can use it in lips too.
Sure, why not?
Jeez. So what are some other options?
Oh, okay. So when you were talking about your preference for Restylane Classic, I've developed a new favorite lately that I am just loving. So I have been talking a lot about using our PRP plasma biofiller. So you've probably heard me talking about PRP before. It's awesome stuff. We draw your blood. We're going to spin it and process it. We get a condensed, concentrated form, and that has all the great stuff in there, all the best things from your blood. We get peptides. We get growth factors. We get platelets. We get
stem cells.
Yes, stem cells. Very important for regenerating tissue, right? We can inject that into joints. That's how they developed it in ortho. You can inject it into a knee. It regenerates tissue. Stop what you're doing. Did you hear that? Yeah. Regenerates tissue.
Highlight.
Red flag. Red flag. It's not a bad thing. It's a good thing.
Blue light special?
Sure. Something.
Okay, that dates me.
Pay attention. Pay attention to this. Regenerates tissue. So when we're talking about an area that we want to be really careful not to overfill, see, that's a big thing that we want to avoid. You don't want a bulge there. You know, that's the main reason we say we kind of undercorrect. So that's why we say expect a little less improvement, because you do not want to overfill there. So the nice thing about the PRP is even if you're going to regenerate tissue. So instead of overfilling, we're going to do a little bit of volume replacement, knowing that PRP is going to go in there and be regenerating your tissue. So inducing collagen production, that's going to like thicken up that skin, make it plumper, juicier, healthier. You're going to see, we're just on a roll today. We are succinct.
It's real life.
Precise. Unscripted, people. Anyway, it's going to regenerate tissue. So when we have dark under eye circles, this is kind of it can treat both. So that's kind of the fun of that, because really filler is not going to treat dark circles. That's if you actually have the volume deficit, that's what that is to correct. But the PRP is great for dark under eye circles. The plasma biofiller is going to replace some volume, albeit temporarily. So when we make that plasma biofiller with both of those components in there, to me, that's win-win. So the difference being, how long would you give the duration for Restylane Classic or for dermal filler to the infraorbital hollows?
Well, if you look at the FDA statement, it's 12 months.
Okay.
I don't
undersell it a little bit for that one, probably. Yeah. So realistically, maybe like 6 to 9 for most people. So the plasma biofiller is going to give you some volume for about 2-3 months, but during that time, that PRP is getting in there and doing its job, regenerating the tissue, inducing the collagen, doing all that great stuff. So with repeated treatment, you are going to have long-lasting results with some of that immediate effect of the filler. So to me, that, again, just win-win. I love it. I'm a huge fan. Did I already post? I might have already put up some pictures of my biofiller.
You like did of your stuff. Yeah. When we did one of the first. Well, absolutely.
I'm going to do it again.
Yeah. Yeah. It was pretty cool.
Yeah. I love that stuff. It's awesome. And then, it's made from your own blood. So it's just for you. Yeah.
Well, and kind of neat and innovative is Mallory just kind of we talked with the PRP guy. And
our
then
guy. We know a guy.
Yeah, we know a guy. We got a guy. And then she just kind of took it and developed it herself and developed her protocol and routine and knows what to do with it and how to do it. And
it's so predictably beautiful.
Yeah.
I love that.
Yeah. And how to inject it. She's going to do mine too. It's just finding the time.
Yeah, I know. That's the hard part.
We'll still say this 3 years from now.
But you know what we did make time for?
I know.
We'll tell you in a little bit.
Yeah, we'll tell you at the end.
Yeah.
Stay tuned.
You might want to know.
Yeah. Here's the thing about filler in the tear troughs also. It can be one of those things. Almost always this is if maybe a less than desirable product was put in there. It can look great initially. With any product, your tear trough will look beautiful when it's injected.
Yeah.
But you could wake up 2 weeks later and look like there's 2 sausages under there.
Yeah.
And filler kind of, and that's why we just say you have to go with the best of what we have to offer as far as fillers in that area. Undertreat it, knowing you're undertreating it.
Yes.
Filler's job is to collect water.
Yes.
That's what it does. Those hyaluronic acid strands collect water and swell. And that's why you always want to undertreat.
Yes.
Fillers kind of it kind of is a living product, right? I mean, it reacts, it's reactionary.
Yeah, definitely.
If you eat a lot of salty food the night before, you'll wake up and you just like it doesn't matter. If you had your lips done, your tear troughs done, anywhere done with filler, it's going to fill up more than other areas not treated with hyaluronic acid filler. You will look puffier. If you are an allergy person.
That reminds me of a really funny story. It has nothing to do with filler, but it just is a picture in my head. I had this friend that we would go to Vegas, in another life a long time ago.
BC?
Before kids, before children. Yeah. And so we were going out one day. We went to the pool the next morning and I'm like, girl, what happened to your feet? And she was like, oh, I swell. I kid you not. I hope she's watching this. I'm not going to call her out by name, but she knows who she is. She gets like walrus like flippers for feet. They're like so swole. She just swells. And it's like, you can't wear strappy sandals. They'll be digging. They're going to dig.
Oh, it's going to look terrible and hurt.
So that just reminded me of how much you can swell, how much our tissues can swell. And you go like, oh my God, can my body handle this? It can. Yeah. It'll come back.
Yeah. My son-in-law, we spent a week in Mexico and he drank, we were on vacation, drank beer, margaritas, floated in the salty ocean.
Yeah.
God, in 1 week, he gained 20 pounds.
Oh my goodness.
And it was all, you should have seen his feet.
That had to be so uncomfortable.
Oh, and then flying back, right? Oh. And you should have seen, he could hardly get his shoes on. So it's like, it's real life. Yeah. It happens,
And some people it happens to more than others.
Yeah. Some people are just reactors and swellers. And the other thing that can affect filler, maybe, there is some thoughts in the the literature that some vaccines can cause some reactivity.
Sure.
I heard a great analogy when I was kind of researching stuff about this, and it, the gal said, doing tear trough fillers can be like a walnut scrub. She said, feels really great in the moment, and then not too long later, you see some long-term results are just kind of lackluster and sometimes harmful.
Yeah.
So, it's not wrong. It just needs to be approached in a thoughtful way and not a quick fix.
Right.
Take
your time.
Yeah.
Go into it.
It's not a one-night stand, people. It's a long-term relationship.
I like it.
Your relationship with your trough filler, it's a long-term one.
There you go.
Bottom line, trust your provider.
Unless it goes wrong, and then you can get it annulled. Just dissolve that shit.
Right.
You need to.
That's right.
There's always that.
Yeah, and I just can't stress it enough. Just trust the person you're going to. Find the person that you will trust.
Yeah.
And have that discussion.
That's the long-term relationship.
Yeah, that's the long-term relationship.
There you go.
Yeah. Find that person and just listen to what they have to say.
Yeah.
They believe it or not, they want you to leave their clinic looking as good as you can look, because that's their name,
Walking
out there too. So they want you to get the best treatment
and
available.
That feels good when people are like, oh man, I look great. You're like, hell yeah, you do.
Mm-hmm.
Yeah, that's the best. That is the best.
Yeah. So
anything else you want to add on that topic?
I think that's it.
Okay, good. Let's go to some fun stuff. This week's obsessions. Okay.
Yeah, go.
You guys, we got eggs. We got duck eggs. It has been the funniest journey watching these eggs. We've gotten some that are like, oh, they're cute little like quail eggs, because they're just getting started, It's very irregular at first. And then one day I went out there and I was like, huh, that's an ostrich egg. I'm pretty sure. There were like 2 yolks in there, and it was huge. Like, I got to show you this picture. It's insane. And then, they've just been all over the board. Now they're starting to get very much more regular. But the little one it was all yolk. It had the same size yolk as the other big ones.
Weird.
It was so funny. Sometimes the shells were like really, really thin, and you could like see through it, or they wouldn't form it was an interesting thing. And this all happened. They just started laying like a few weeks ago. So there's a dozen duck eggs sitting on my counter right now, and my heart is just so full. I love it. I'm so excited. They taste great. We're really like,
and you don't wash them, right? So you can leave them on your counter.
You don't wash them. They have a bloom on there, so you leave that. Sometimes a little straw stuck to it.
Yeah,
it's very
or something else.
We're very fancy. Mostly the straw stuck because of something else. And so right now we're just trying to make sure that we get them before they freeze.
Yeah. Oh.
Yeah, that's always a bummer when you go out there.
So are they laying everything outside? Or
they're
in their house.
They're laying them in their house.
They do that.
They do.
Okay.
We've set up a couple nests for them. They've got that pretty much down, because they're pretty much in there all day right now. It's pretty chilly. Today there's some sun out, so they might go out.
So how many girls?
So we have 4 girls.
And 1 boy?
No
other boys.
No other males.
Okay.
No males at this
time.
No
males. Okay.
No more males. But we have 4 girls, and they are all laying. So one day I collected, I can't remember if it was 7 or 8, because they laid in the morning and then they laid again in the evening, and it was like, yes!
That's crazy.
I was so excited. This has been since last March, this journey. So we finally got some eggs, and I am beyond excited.
That's so fun.
Yeah. So that's my personal one.
So I just have this, I'm just going to talk about this kind of this cream that we have that's for melanin suppression. And there's different ways to go about it and different ingredients you can use. And the one that everybody knows or is most often associated with that is hydroquinone, but not everybody wants to use a hydroquinone, and
or not everybody can,
or not everybody can use a hydroquinone. So we have another one that's hydroquinone free.
Yes,
and it has lactic acid, kojic acid, and
if you're putting me on the spot, I won't remember.
I know. But those are the 2 things that really it's retin-A free and it's hydroquinone free.
Yes.
Kojic acid is a really powerful melanin suppressant. So for people who just really don't want to use a hydroquinone, for very valid reasons.
Sure.
There's some thoughts about that long-term hydroquinone could be a carcinogen. We don't really have good data about it, but I know
Let's
in
not
some
risk it.
places in Europe they've banned its use
Yeah.
for now. So there are other options for people who don't want a hydroquinone.
And to caveat that, we don't recommend staying on the hydroquinone.
We do
very
have
long
hydroquinone
anyway,
based one also,
Sure.
but
we recommend switching back and forth. So
yeah. So anyway, I just wanted you to know that was available.
Yeah.
It's a really great time to work on suppressing your pigment B at a time where for most people it's going to be less active.
Yes.
And
that one you can use twice a day.
Yes. And it's not that we don't talk about things. We always want to talk about lightening things. Well, melanin suppressants don't lighten. They suppress the melanocytes' activity so that the rebound effect is that things that are brown pigmented areas become less affected and look brighter and lighter. More even toned.
Yeah.
So,
okay, so that was your professional one.
Yeah.
What's your personal one?
Oh.
Okay, you can think for a minute because I'll tell you about my professional one then.
Okay.
Maybe it will be your personal one. So we made time. We put it on the calendar. We have scheduled something for ourselves. We are all getting together and we are going to blast each other's faces on Friday after work. We are doing pro fractionals. I'm excited.
All around.
Yeah.
Well, at least 3 of us.
Yeah.
Maybe Jenna. She doesn't know yet.
I think Maurice has other plans for her.
Oh, okay.
Yeah. But
yeah. I thought,
but it's going to be awesome.
Yeah.
We'll show you pictures. So Joelle and I were talking the other day and we had done a couple of professionals for our clients lately. And we're like warning them like, okay, plan to just swell up like crazy. You're going to be unrecognizable potentially. Like we show pictures of us, what we look like.
Nuts.
And then wouldn't you know it, these girls just go off and they're like sending us pictures. And I'm like,
not swollen at all.
Oh, must be nice.
This is really good. I'm like,
all right, Joelle, we got to do this. We got to show them how the swelling is done because they don't know how to do it.
That's right.
And we do. You just got to see. Never have Joelle and I looked more related than when we were both swollen post-professional. You'll enjoy.
So we'll see. It'll be fun.
Yeah.
We'll all document our
the journey.
Our days and journey. Yeah, we'll see.
Yeah.
So, all right. Well, this has been fun.
Wait, did you find it?
Oh,
come on.
Oh, well, I can share this, I guess. My daughter that has the 14-month-old is pregnant.
Oh, yay!
She's due in July.
This time
with she had a little girl named Ivy a year ago in November, and this time it's a little boy.
Oh my gosh.
So yeah.
Gender jackpot. She gets one of each.
So I know.
Oh, that's so exciting. Congratulations.
Thanks.
Oh,
but this is really kind of funny. I thought it was funny. But when Ivy turned 1, I bought her a little baby doll because it's just this little soft baby doll because she needed a little baby doll.
Yes.
And she unwrapped it or took it out of the bag, and she looked at it like this is the baby doll. She looked at it. She goes,
who needs this? I don't need this.
Every time I handed her that baby doll.
No, not interested. Got it loud and clear. So we have our work cut out for us before she gets a brother. We don't want her.
She did. My daughter did send me a video, I don't know, a week or 2 ago, that she will take the baby now and give baby a kiss. And so she will give the baby a kiss.
Aww.
And then she shakes it a little bit.
Listen, little baby.
Drops it.
Okay.
Yeah, they're so funny.
Yeah, kids.
Yeah, anyway,
all kids. All right.
Okay.
Sayonara.
Yeah.
So long.